cancer in chronic leg ulcers is often underdiagnosed, which may contribute to treatment delays and poor outcomes, including high mortality in metastatic cases. My name is Dr. Gina Chacon Osorio. I am an internal medicine physician. I completed a postdoctoral program in clinical and translational science during my internal medicine fellowship at the Mayo Clinic in Rochester, Minnesota. The name of our article is Skin Cancer Associated with Chronic Leg Ulcers in the Population of Olmsted County, Minnesota. Our study aimed to determine the incidence and clinical characteristics of skin cancers in chronic leg ulcers in the Olmsted County population from 1995 to 2020. 41 skin cancers were identified in the non-healing leg ulcer in 37 patients. The overall incidence rate was 470 per 100,000 patients. 11 men and 26 women were in the study with a mean age of 77 years. A history of venous insufficiency was present in 81% of patients and diabetes in 35% of the patients. Clinical characteristics of chronic leg ulcers with skin cancer included abnormal granulation tissue in almost 88% of the cases, along with irregular borders in 85% of the cases. Skin cancers included 17 basal cell carcinomas, 17 squamous cell carcinomas, 2 melanomas, 2 porocarcinomas, 1 basosquamous cell carcinoma, 1 invasive non-small cell carcinoma, and 1 eccrine adenocarcinoma. The association between chronic wounds and skin cancer was primarily observed in elderly patients. 2 of the 37 patients developed metastasis and died. The first patient was elderly, initially misdiagnosed with onychomycosis of a toe, and later diagnosed with melanoma. The second patient, in his 30s, had a history of an infected wound on his leg, was diagnosed with eccrine adenocarcinoma, and died due to metastasis. Notably, the average time from patient report of ulcer to biopsy was 1 year. This study is important because it provides new data about skin cancer in non-healing leg ulcers. It may influence the clinical practice in the identification of at-risk individuals. The knowledge that skin cancers can present as ulceration and can also develop within an ulcer will help clinicians lower their threshold to biopsy. Skin biopsies are potentially life-saving diagnostic interventions that should be considered early in the management of an ulcer, especially if the ulcer is not responding to therapy. The takeaway message for patients is that skin cancer is the most common cancer worldwide, and the incidence rates are increasing. Skin cancer that develops in an ulcer with chronic inflammation could be aggressive and metastasize to distant sites. In terms of next steps, it is important to develop reliable practice guidelines for the early identification of skin cancer in non-healing ulcers, especially in skin of color and elderly patients. Larger prospective studies are needed to explore further the characteristics of both chronic leg ulcers that develop into skin cancer and the risk factors associated with poor outcomes to decrease morbidity and mortality. Thank you so much for your attention, and please read our article for details in the July issue of Mayo Clinic Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.